And what are the changes coming up for open enrollment in 2019? Hey everybody, it's Valerie Van Boeven. Today we're going to talk about Medicare. What is it? And if you're not 65 or if you've not even turned 64 yet, you may not understand everything there is to know about Medicare. And we're going to cover the basics, and I'm going to tell you where you can get more information and where you can go to research your options. So today we are talking Medicare and the changes coming up for 2019 open enrollment, which will affect us all in 2020 for those of you who are eligible for Medicare. So let's get started. Today's episode is brought to you by Star Multicare Services, your health, your home since 1938. They have offices in New York, South Florida, Pennsylvania, in Allentown, Lancaster, and Pittsburgh, and they also serve Central Ohio. So if you are in need of home health care or private duty non-medical care, and you live in any of the areas listed on the screen, give them a call and they can help. So let's start this way. What is Medicare? For those of you who have never had to deal with Medicare, you haven't had an aging parent who's been on Medicare, this might be something you haven't even taken the time to look at yet, and that's okay. But understanding the basics is important for everyone. So Medicare is the federal health insurance program for people who are 65 or older, certain younger people with disabilities, and people with end-stage renal disease, which is permanent kidney failure requiring dialysis or a transplant. Sometimes it's also called ESRD. There are different parts of Medicare. So just like the health insurance that you might have from your employer or that you have privately, different parts of Medicare cover different things. So Part A is hospital insurance. So Part A covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. Part B is your medical insurance. So Part B covers certain doctor services, outpatient care, medical supplies, and preventative services. Part D, which was added on a few years ago, Part D adds prescription drug coverage to original Medicare, some Medicare cost plans, some Medicare private fee-for-service plans, and Medicare medical savings account plans. So that all sounds really complicated. So the insurance companies out there decided that they would be helpful and sell more insurance, health insurance. They invented Medicare Advantage plans a long time ago. This is kind of known as Part C. If you go with a Medicare Advantage plan, this is an all-in-one alternative to original Medicare. You don't have to do it, but you can. A lot of times these bundled plans include Part A, Part B, and usually Part D. And they add on stuff. You can have extra benefits in there or extra things. And they have to follow the rules of original Medicare, but they make it, I guess, it's more incentivizing to go with maybe a Medicare Advantage plan. The best way to enroll for Medicare is, especially if you want a new plan or you're 64 and a half, is to call 1-800-MEDICARE. That is the best place to go. Enrolling in a new plan directly through Medicare is the best way to protect yourself if there are problems with enrollment. Write down everything about the conversation when you enroll through Medicare, including the date, the representative you spoke to, and any outcomes or next steps. Before you enroll in a new plan, follow some simple advice to find the best plan for your situation. I'm going to give you some websites at the end so that you can go and do some research on your own. Let's talk about expansion of Medicare Advantage supplemental benefits. Okay, Medicare Advantage plans, we just talked about them. They kind of bundle all this stuff together. So you might have one through United Healthcare, or there's a million of them. And you usually, if you watch any kind of daytime television, you're going to see right now, especially Medicare Advantage plan commercials out the wazoo because it is open enrollment season, starts October 15th. So everybody's getting their ads up there. Some Medicare Advantage plans cover services that are not covered by original Medicare. Woohoo! Common supplemental benefits include dental care, vision care, and hearing aids. Starting in 2019, and this is kind of important because these are some things that are changing, Medicare Advantage plans were granted more flexibility in the supplemental benefits they are allowed to offer their members. This includes the ability to offer benefits that are not directly considered medical care. If you watched the video on home health care versus home care, we talked about what Medicare covers and what those rules are. However, starting this year and into next year, Medicare has said, okay, we get it. Maybe some people who come home from the hospital might benefit from some of these non-medical services. The object of the game for us at Medicare is to keep people from readmitting to the hospital. So if we want to decrease seniors having to come back to the hospital for the same problem over and over again, maybe some of these other services like non-medical home care or a wheelchair ramp or some of these other things might be helpful. And if we pay for part of them or maybe all of them, then we might be able to prevent people from coming back. They might be healthier. The benefits might include nutrition services, in-home supports, and home modification. So in-home supports would be your non-medical in-home care. And every Medicare Advantage plan is going to have their own set of rules, their own set of how much they'll pay for, their requirements for you to get it, how long they'll pay for it. Everybody's going to be different. It's not going to be a long-term fix. But I would say that probably, let's say you came home and you had a hip replacement and the wound got infected. So you're receiving some in-home antibiotics or you have a wound pump or something like that. So you've got some medical stuff going on. But what we also know is that you might benefit from having a non-medical person come in every day and maybe do a little light laundry, a little light housekeeping, maybe help you get a light meal, your lunch prepared. Maybe you need a little help getting a bath, something like that. Those are the kinds of things they're considering, and that is what this means by in-home supports. It is temporary, it is not forever, but it might just get you over the hump and keep you from readmitting to the hospital for problems with that hip. So nutrition services could include things like going to see a nutrition therapist, or it could mean that you do have somebody come in do light meal preparation for you, someone who comes in and makes sure that you're doing okay with your diabetic diet. I don't know. There's all kinds of things, but when you talk to your Medicare Advantage plan folks and you're getting ready to re-enroll, you might want to compare and see if your plan covers any of these things in case you might need them. Home modifications would be things like I mentioned, maybe a wheelchair ramp, maybe installing grab bars in the bathroom. I mean, I don't know what they would cover, but if they do cover some of it, they will outline those benefits for you. Now, starting in 2020, plans are allowed to begin offering even more services to certain members with chronic conditions. So chronic means more long-term conditions. So it'll be really interesting to see what happens there. These changes mean there may be more factors to consider when comparing Medicare Advantage plan options during fall open enrollment. Carefully review a Medicare Advantage plan's evidence of coverage and any other materials from the plan. If you are considering a new plan that offers its members additional supplemental benefits, make sure to find out about the costs and coverage restrictions associated with those benefits. Just because the plan says, yes, we'll pay for non-medical in-home care, you need to look at what the restrictions are. Is it only for 3 weeks per year? Is it for 6 weeks per year? Is it only for 2 hours a day, 4 hours a day, 8 hours a day? Is there a monetary limit? Do you have a copay when it comes to those services? You need to make sure you understand what you're buying when it comes to Medicare Advantage. Just know that you can get some of these extra services now that were never available before. So it's important that you ask. The best advice, if there's one mantra for the fall open enrollment season, which starts October 15th, by the way, It's review your options. Every year, the Medicare Rights Center advises people with Medicare to carefully consider how they get their Medicare benefits. Most people are allowed to make changes only during fall open enrollment. There are also open enrollment periods for other people who have different special needs, but for most of us, it's going to be the fall open enrollment period. Consider all of your options. Since many plans make changes every year and your current plan may not be your best choice for 2020, shop around to find a plan that best meets your needs and makes the most financial sense to you. It also has to be affordable, right? And if they're offering these special awesome benefits, but you can't afford any of them, that doesn't really make a whole lot of sense. So just make sure you check out what everyone's offering this year. It's going to be a big year for changes. If you're not sure what kind of coverage you have, check your red, white, and blue Medicare card. Check all other insurance cards that you use. You probably have one. If you have a Medicare Advantage plan, you probably have an additional card. Call the phone number on the card to get more information about your coverage. And check your Medicare health or drug plan enrollment. You can call 1-800-MEDICARE, which is 1-800-633-4227, and ask questions there as well. Now, what I wanted to give you also are the websites that can help you. If you already are enrolled in Medicare and you're a web internet user, you may have an account on mymedicare.gov, mymedicare.gov. You go there, you can create an account if you don't have one. It is something that a lot of people do to help kind of keep track of what's going on. And if you have one, you might want to go there and see what the changes are and what different plans are offering. If you need more info just on basic Medicare, just understanding what it allows or, just different benefits, you can go to medicare.gov. So there's My Medicare, which is people who are enrolled, and there's just a basic set of information at medicare.gov. Another great resource that Medicare, they fully support and they probably created is called MedicareInteractive.org. MedicareInteractive.org. If you go there, you can also compare some plans and get some good information. Now, the Medicare 2019 Open Enrollment Guide is available in many different places, and it is free. And so we put it on our website. It's the exact same guide that Medicare gives out. If you want to just go to our site, you don't have to add your name or email or anything. All you have to do is just go there and download it. You go to bit.ly, so it's bit.ly/2019 Medicare. So it's bit.ly/2019 Medicare. And when you go there, you just automatically download the free guide that just came out for 2019 open enrollment. So you have from October 15th to December 7th to make any changes to your plan or get enrolled or whatever you need to do. So don't delay, because I guarantee you December 7th is going to be, if you worked at Medicare, you probably hate that day because everybody's trying to do their last minute stuff. Start early, do your research. If you need to make changes, make changes. If you don't need to make any changes, then you don't have to do anything, I suppose, unless you've been instructed to. So make sure that you get your information updated and choose the plan that's right for you. So that was our video on what is Medicare, the open enrollment season for 2019. And this is Valerie Van Boeven with Approved Senior Network. This episode was sponsored by Star Multicare Services, your health, your home since 1938, with offices in New York, South Florida, Pennsylvania, and Central Ohio. If you need anything from them, you can call their main office location in New York at 631-956-8835. Thanks, everybody, and we'll talk to you again next week on Approved Senior Network TV.